Again, welcome to the Emergency Management Division. We will have some information. We'll try to answer your questions. We'll start with Dr. Linda Bell of the Department of Health and Environmental Control. Doctor.
Thank you, Governor. Good afternoon. Today we announce 528 new cases of COVID-19 and 7 additional deaths. This brings the total number of cases in South Carolina to 15,759, and the total number of deaths to 575. And I have to say that today I am more concerned about COVID-19 in South Carolina than I have ever been before. For the past 2 weeks, we've seen some of our highest daily numbers since the pandemic began, and there have also been recent increases in our percent positive, which tells us that more people than we would hope for who are being tested are sick. This is why we need everyone's help in re-emphasizing how critical it is for every one of us every day to wear a mask in public and to stay physically distanced from one another. Those two precautions, masks and social distancing, are how we stop this virus. Yesterday, DHEC issued a joint statement with the South Carolina Hospital Association and the South Carolina Office of Rural Health, reiterating how vitally important it is for all South Carolinians to adhere to these disease prevention methods. So we're all eager to return to our normal lives, or what our new normal will be, but it will take us that much longer to get there if we don't stop the virus today. It doesn't take hard data to observe that many people across the state aren't social distancing and aren't avoiding group gatherings and aren't using masks in public. And we really need all South Carolinians to take these precautions every day, not just to protect ourselves, but to protect others who could become severely ill or who could even die if they're exposed. Our increased testing data has allowed us to better identify hotspots, and this has recently included Greenville County. Greenville County has seen some of the highest daily case counts for any county in the state for over a week and a half. And when we identify a hotspot like Greenville, we dig deep into the data and we use the confidential information provided to us in our epidemiologist work to help identify risk factors that could contribute to the spread in these areas. For Greenville, we've determined that several cases are stemming from some households, meaning that family members are infecting each other not unexpectedly in their homes. And that's why it's important to follow the advice of healthcare professionals and to stay in isolation and quarantine if you're diagnosed or you're a contact. And this helps protect your family. But we've also determined that approximately 31% of recent cases in Greenville have been occurring in a large Latino population. And so we've immediately targeted our outreach to efforts in these communities, and this has included interviews on local radio stations, Latino radio stations, and the redistribution of our Spanish translated educational information and resources in these areas. We continue to increase COVID-19 testing availability in Greenville, and with the thanks of local hospitals and healthcare providers in healthcare facilities in those areas, we continue to work with community partners to accomplish that. And while we work to identify hotspots of virus activity in the state and take extra steps to help stop the spread of the virus in these areas, I ask everyone who's listening to me now to ask yourself how you can possibly help to stop the spread of the virus, what you can personally do to protect yourselves and to protect your communities so that we can return to normal activities sooner rather than later. This will help us reduce the impact of the virus that we are all experiencing if we take these individual measures and ask ourselves if there's more that we could do to stop the spread of the virus. Your community might not be a hot spot today, but there should be no mistake that COVID-19 transmission is still high and widespread in South Carolina at this time, and it remains a threat to all of us. The preventive measures that we are encouraging are really the only things that we have right now to keep us safe in the absence of a vaccine. We know that what we've been asking everyone to do is not easy, but I can't stress enough that it's really absolutely necessary. And working together, we can turn the tide on COVID-19 and help save more lives in South Carolina. Thank you.
Just a number of things. First of all, just to echo what Dr. Bell said, this is it's a question of individual responsibility, and it's something that we all have at our disposal. When I was growing up, I remember when the Smokey Bear campaign was relatively new. Smokey Bear was a little bear that was found after a forest fire out west someplace, and he became the emblem of preventing forest fires, the symbol. And he was always saying, only you can prevent forest fires. Y'all probably remember that. Well, that appealed to children. What we're trying to do now is appeal to adults, children, and everybody in between. As Dr. Bell has said, and you've heard just about every day of over almost 3 months now, coming from this place and others, is that we all have to practice that social responsibility by not becoming infected and not infecting others. And whether it's by wearing masks, wearing shields, keeping the social distance, staying out of confined places, avoiding crowds, it's just a question of being respectful of your fellow citizens. And that is the only way that we will stop this virus, short of a vaccine. And the vaccine is not here yet. We don't know when it's going to be here. But it's disappointing to go to places and see people all jammed up in crowds, celebrating the beautiful weather, celebrating being in South Carolina, but at the same time exposing themselves and possibly others to these risks. And the ultimate price for this lack of care is death. And it's serious, and we've already had 575 people die from it. Now, I'm not saying that they were the cause of their demise. Perhaps it was somebody else, but you don't want it to be you. So we've got to be careful. And again, we have it, each of us has it at our disposal, in our power, to be careful. And so whatever happens, we cannot keep businesses closed forever. We can't isolate South Carolina from the rest of the world. What it boils down to is we must be careful individually. So we're asking, all of us that work on this every day are asking everyone else to take these requests, take this information to heart and be careful, because this virus is with us. It's not going to disappear. The cold weather, the hot weather is not going to kill it. It may be seasonal, it may not be, but it's on the face of the earth, and it's going to be here until a vaccine is created for it, and that is not here yet. So we have to be careful. Now, in South Carolina, we have taken some steps to see that South Carolina accelerates back into the economy. As you know, the economy in South Carolina was way up at the top in the country. The economies were booming all over the United States, and we were right at the top. Well, we want to get there again. The virus has certainly slowed us down, but we can't stop, and we can't remain shuttered or restricted much longer. So we are I'm asking the General Assembly, and we've had meetings with the leadership of the General Assembly on a number of these, and I'm presenting a report to them today from the Accelerate SC Committee. It's a tremendous report. As you remember, we had about 30 permanent members and then others that participated, including all the state agencies, to come up with plans to keep the people safe and healthy and also re-accelerate or revitalize the economy. In South Carolina, we didn't close hours down like they did in some other places, but we certainly slowed down. But it's time, even in this situation where we still are faced with a deadly virus, we must accelerate our economy. And don't just think of the businesses and the big buildings, and think of the families. Think of the people who are dependent on their jobs. Think of the people taking their children to school, or will be taking them back to school in August and possibly some this summer. But just look at those people. Look at the workers. Look at the people you see in the stores, in the grocery stores, bank tellers, people working in the streets, all kinds of people in South Carolina, many in the tourism business or the service industry. Just think of those people, young and old. They need to work. They have to have money to pursue their life's plans, to feed their children, to pay the mortgage, to pay their bills, to keep the electricity on. So we have to get back to work. So the Accelerate SC has a variety of recommendations to the legislature. But probably the three that would be of the most interest at this time is first is that Unemployment Insurance Trust Fund. The Unemployment Insurance Trust Fund is money that is paid by businesses based on their payroll. So when their employees are laid off, they'll have a fund to go for I think it's 20 weeks. The maximum is about $326 a week. In this virus period, the federal authorities have added $600 to that. So it's a hefty amount going out, but our trust fund started off at $1.1 billion. Now, in 2008, 2009, it was just about drained with the unemployment back then, as you remember. We had the state borrowed money from the federal government, and just a couple of years ago, we ended up paying it back, and we were able to even reduce our taxes on the businesses. And when the virus struck in March, early March, we had $1.1 billion. Well, estimates are that by the time we get to December, we will be over $600 million short. So what we're asking the General Assembly to do is from that $1.9 billion to immediately when they arrive back this month for the first session is to provide at least $500 million into that trust fund. Of the $1.9 billion, at least $500 million. That will take us, if the best scenario, the most optimistic pictures for our economy hold true as predicted by the Department of Employment and Workforce and others, that will almost bring us back up to level. It's likely to be short. If the downturn, if the economy is worse than we thought, then that $500 million won't be nearly enough. But we're hoping for the best. We're hoping to go back to work, but we've got to have at least that $500 million to go in immediately, and we'd like to have more than that. We'll be working for that. I'm also recommending that $215 million from the fund, from the 1.9, be used to reimburse public school districts who provide additional days of classroom instruction before the scheduled start of the school year, or expand their hours during the school year or before the school year. What this will do is it will bring 5 days of early instruction or expanded hours to the children who have missed that because of the closure of the schools, and bring those children up to full speed so they'll be ready to enter school. And that is they'll be able to absorb, they learn. You miss things over the summer anyway, but with this virus closing down the schools early, although we had a terrific distant learning program going on, there were a lot of students still need help. So we're asking for $215 million for that. Also, we're asking for $225 million that be directed for the reimbursement of verified and legitimate COVID-19 related expenses incurred after March 1st for the state agencies, local governments, first responders, hospitals, institutions of higher education. That'll allow these government agencies to reconcile their books by the end of the fiscal year, and we'll be off to a good start. So those are our plans at the time. We've had conversations, we in the office have had conversations with the leadership in the House and the Senate, as well as the agencies. I want to thank again the members, those who participated in Accelerate SC. It's really a unique operation, a unique assembly of talent to find our way, the best way to re-accelerate the economy in South Carolina, which accelerates the happiness and strength of the people in South Carolina, and that is our goal. Not only to go back to where we were in our economic growth and strength, but even more as we move forward. With that, I'll be glad to answer questions.